Hello? Can I speak to Mr. Hodgkins, please?
Speaking.
Mr. Hodgkins, it's Veronica Garcia here. I'm the RMO at Winston Private Hospital. I'm calling because I'm a bit concerned about one of your patients. It's Mrs. Townsend in bed 14. I don't know if you know who I mean.
Ah, Mrs. Townsend. Can you fill me in a bit about her?
Sure. She's a 45-year-old woman who came in 3 days ago for an open cholecystectomy. You may remember that she wasn't a candidate for a laparoscopic cholecystectomy.
Oh, yes. I remember her now. Is there any relevant past medical history I should be aware of?
Yes. She suffered from cholecystitis for quite some time and had a very large gallstone removed a few days ago, as I mentioned before. The size of the gallstone was the main reason for open surgery rather than keyhole surgery. In addition, she has a long history of alcohol-related cirrhosis of the liver. She had a recent chest infection, which was treated by her GP. I'm concerned about her now because she's in a lot of pain, despite using her PCA regularly. She's had quite a few breakthrough doses of analgesia, but is still complaining of localized pain around the incision site.
Her temperature?
She's been spiking a temperature between 38 and 38.5 over the past few hours.
OK, you said she's got a lot of localized pain around the surgical incision.
That's right. She seems to have more pain than one would expect, even with open surgery. One of the nurses also asked me to check her wound. She noticed that it was very red and had an offensive smell. The redness has been spreading, and I'm a bit worried about the possibility of a collection or abscess.
Yes, I see. What are her other obs like?
Her BP's elevated and she's tachycardic. She's also quite breathless. Her SATs are running around 95–96%.
OK. And her urine output? Is she passing urine OK?
Yes, no problems there.
Lungs OK? No sign of chest infection?
She is coughing a little, but she hasn't got a productive cough. She says that she has been coughing like this since her chest infection, the one I mentioned before.
OK, so she's febrile and tachycardic. Her BP's up and her SATs are down a bit. No sign of chest infection, but the wound doesn't sound good.
That's right. It's the wound I'm most concerned about, and the fact that her pain is not controlled either.
Can you send off some blood cultures immediately?
Ah, yes, I should have mentioned that I've already done that. I'll phone you as soon as I have the results.
Great. Can I ask you to send off a wound swab too? She'll need to start some IV antibiotics straight away. Can you sort that out for her now?
Sure. I'll put in a line and get the antibiotics started.
Can you let her know that I'll come by and see her this afternoon?
Certainly. I'll start some IV antibiotics and ask the nurse to send off a wound swab. Is there anything else you'd like me to do before you come this afternoon?
Just ask the nurses to keep an eye on the wound and check her obs hourly until I come by. I'll probably be there around 3 p.m. after I finish my clinic. If her condition deteriorates, let me know immediately, won't you?
Yes, I'll do that. Thank you. Bye.